for inviting me just to talk about supplements again. So most of you are very familiar with the mitochondrial cocktail and where to find them in various places. So today, in terms of the overview about what we're going to talk about, I thought we will quickly review about what we've talked about in the past about people's reception or perception of supplements, and then moving on to the current times, how supplements actually fit into the overall approach of managing mitochondrial diseases. We'll quickly review the ARTG labeling and talk about actually some of the more common supplements that's also relevant to people with mitochondrial diseases before going into the mito-specific supplements. And the ones that I'll specifically talk about more of are vitamin B3, coenzyme Q10, and idebenone. And then finally to the more meal-specific supplements. And those would include L-arginine, citrulline, and taurine, followed by a short period Q&A. If I speak too fast or there are things that you're not clear about, please let me know. I'll slow down or try to explain. And I apologize in advance if I don't touch on the particular supplement that you were hoping to find out more about. So back in 2016, this was published from the American group based on a self-reported retrospective study on 162 people. So as you're aware, the majority of them were on supplements, and in fact, 3/4 of them had more than 4 supplements. They had perceived benefits and they paid a lot for their supplements. And despite other treatment, including things like anti-epileptics, physical therapy, and diet, the Americans seem to think that the supplements were the only intervention that were actually improving their symptoms. Now, we knew about the symptoms that mitochondrial disease sufferers often have, including things like fatigue, weakness, feeling hot or cold, exercise intolerance, muscle aches and pains, tummy and gut problems, droopy eyelids, headaches and migraine, and mood symptoms. But the majority of them actually fall within the neurological and the gastrointestinal symptoms pathway. So with this study, they found the most common supplements included coenzyme Q10, and over in the States, they use a lot of L-carnitine, vitamin B2, which is riboflavin, and also vitamin D and C, which we here also use a lot of. The majority of people did not have side effects from their supplements, and about half of them thought that the supplements were helpful for their most troublesome symptoms. But for the less responsive symptoms, they included the gastrointestinal symptoms and the neurological ones. And as you know, they were the actually more prominent ones. So it's a pity that the supplements didn't help them. Now, maybe about 1/3 of them thought that there was no improvement despite all the supplements, but they still stayed on them. Only about 1/4 of them decided to stop them because they thought that they were the only things that helped. But this is 4 years ago. And this was compared to the Europeans in a Dutch study involving both children and adults, where the adults reported the therapies that were effective were not actually supplements, but more related to food supplements, homeopathy, or self-help techniques. So you can see the difference between the Europeans as opposed to the Americans. And since then, not that many specific studies in large cohort about supplement use in a very general sense has been published. So I think the Mito Foundation has asked us, the clinic, about what we advise for patients as for replacement for ATP support, because we know Bioceutical is no longer making that particular supplement. And this is not an official thing or necessarily to say that this is the supplement to take. The things that might look alike to ATP support might be a combination of different supplements from different companies that includes a combination of magnesium, different magnesiums, coenzyme Q10, and various B vitamins, etc. So we have advised some of the patients to say, okay, if you really wanted something similar to ATP support, why don't you try something like ultra muscle energy combined with cardio nutrient food, etc. As you will see from my presentation going forwards, I'm not sure that these are the best options or that you should even write it down to take these, but we probably have to revise this on a regular basis and reconsider what we spend our money on. So now we might move on to 2020, how we might be viewing supplements in the whole context. So now here is a traffic light place of a button that's very close to the hospital. Can you observe any difference? So as moving with the time, you can see, used to look like this. And then when the pandemic first came, it was all paper form. And then now it's formalized. I don't think they think that the pandemic's going to go away very quickly. And in a similar vein, where there's not a huge difference or huge knowledge difference in the last 4 years, we have come to learn a little bit more about the various supplements. So this is a paper that was published by Viscomi and colleagues recently about new therapies for mitochondrial diseases. And in that, they divided the supplements or the various approaches to treatment into two kind of different areas. One is the general therapeutic strategy, and the other one is the specific therapeutic strategy. And supplements will definitely fit into the more general side. So as you can see for the general side, it's not specific to a particular mitochondrial disease. It's not specifically treating a particular genetic abnormality or a particular protein that might be abnormal. It could have a maybe a wider application to a number of mitochondrial conditions. And overall, even though the supplements are still on the expensive side, they might be a lot cheaper than the other option, which are the more specific therapy, which nowadays include clinical trials into genetic therapy, including those with Leber's hereditary optic neuropathy, things like TK2 and OPA, etc. So today we're going to just concentrate more on the general and the supplement side of the strategy. So in terms of general therapeutic interventions, you can see supplements are something that include things like antioxidants, respiratory chain cofactors, and things that make more mitochondria. We call it mitogenesis. But they would also include other things such as dietary modulation with things like ketogenic diet, low GI diet, or things like the mTOR pathway. Some of you might have heard about things like sirolimus or rapamycin, which modulate the cell system in terms of garbage disposal, so to speak. So autophagy and mitophagy, which is how the cell kind of process the damaged components within the cell and get rid of them. There's also studies in animal studies about hypoxic conditioning. If animals were put into 11% oxygen instead of 21%, some of the mitochondrial models, the mice actually live longer. But for us human, in terms of current days, I think whilst we seek all these new therapeutic intervention hoping for magic, please don't forget about the other symptomatic treatment, which actually play a huge part and makes a huge difference in patients with mitochondrial diseases. And those include things like anti-epileptics, exercise therapy, which Brent will talk about shortly, and nutrition. Whether you are having a too much weight or too little weight, that's also relevant. So why do we like supplements so much? It's because we can get it over the counter. It tends to not cause too much significant side effects, and they're generally a little bit more affordable than things that, are more specific. However, with supplements, they can be inconsistent in their efficacy. As we know, people would think certain brands might be more relevant than other brands. And in fact, each different brand may not have had their own randomized study to say how effective they are. Supplements are overall less rigorously studied and less rigorously regulated by governments. So we can't completely be sure what we are getting, particularly if you're getting supplements overseas. And we may not be sure that what we are getting would necessarily work, whatever hype has been behind those supplements. I'll go quickly into the ARTG labelling, which is the Australian Register of Therapeutic Goods, where therapeutic goods can be lawfully supplied in Australia. So AUST-AL mean registered medicines. So these are medicines that are proven to be safe, of quality. So what you're getting is actually what's labeled on there, and effective. Whereas AUST-L, which are the listed medicines, are assessed for safety and quality, but not necessarily for effectiveness. So you can see them on bottles from things that you might be able to get from supplement shops or from chemists. So you can see them in small writing. So all the supplements, you know, Q10, magnesium, they tend to be in very small writing at various places in the bottle. Whereas things like paracetamol, you can see that they're actually AUST-AL. Now, these labeling may not be available if you were to get those supplements online through things, international suppliers. So you just need to know that when you pay the money to get them from overseas, there's no proof that what they say they are selling is necessarily what you're getting. So now we move on to the more common supplements that I do not want you to neglect. Things to take. Now, the majority of us have not been going out as much in the pandemic. So, and even normally when we go out normally in winter, the majority of us are actually low in vitamin D. Now, as we know, vitamin D is very important for our bone health. And for most people in winter times in particular, it would suggest about 1,000 international units a day. You won't necessarily notice a huge difference unless it's severely deficient. Some people can have muscle symptoms with it, muscle aches and pain with it. But its adequacy will be very important for your long-term bone health into your older age. So that if you fall in future for whatever, if you have stronger bones, you're less likely to fracture a hip, for example. Other things to look out for are vitamin B12 and folate, particularly for those of us who have a lot of gastrointestinal symptoms, have constipation or diarrhea, where absorption of these vitamins are not necessarily complete. Your doctors will particularly look for these vitamins if you have neuropathy, because deficiency in these can cause worsening in your neuropathy, and if for severe and long enough time can even affect your central nervous system in terms of your cognition. Iron deficiency is common, more common in women because of menstruation. People with heavy periods should look out for this and talk to your GP about, you know, whether checking that there's any deficiency in these before you consider taking them. And this is in contrast to those where we tend to have a lot more of. And lately, we've been noticing a lot of patients seems to have overdose on vitamin B6 or pyridoxine. If you can notice, the daily requirement for an adult is only about 1.5 milligram. But even in mixed supplements, as you can see on the powder forms or things that you can get from vitamin B complex, they often come in 25 to 50 milligrams. And this is a lot higher, even compared to the dose we recommend for people on things like tuberculosis treatment, because a particular antibiotic actually affects the B6 metabolism. So normally, even in people with deficiency, we're only advised 25 milligrams. So if you're on vitamin B supplements, I'll ask you to have a look at the bottle to see how much supplement is there. And particularly if it's higher than 25 milligrams in whatever you are taking, you may want to check with your GP whether you have actually already overdosed on it. The relevance is if you have overdosed on this one for a protracted period, a number of years, it can put you at risk of neuropathy, just as if you were deficient on this. And it can come in a small fiber format in terms of aches and pains, usually burning kind of feeling in the feet. That's different from a large fiber nerve problem. Now, the other thing that we tend to overdose on is vitamin C. So vitamin C often comes in 250 milligrams to about 1,000 milligrams in tablet and chewable tablets and things. But what we really need is about 120 milligrams. There's some Cochrane study to suggest that if you take about 500 to 1,000 milligrams a day, it reduces the frequency of your cold or get you over the cold, but you have to take it every day, not just when you're having the cold. And we will see that it's also studied in mitochondrial conditions as an antioxidant and as part of the treatment pathway that's often added onto the cocktail. Other things to watch out for are things like vitamins A and E, because these are fat-soluble vitamins. If we take too much of it, it doesn't come out of the body easily. It doesn't just come out in the wee. So be careful when you select your vitamins that you don't overdose. So now we go into the mitochondrial specific supplements in terms of the vitamin B3 and the coenzyme Q10 and the idapanones. So we'll come to a little revision about the respiratory chain, which is in the mitochondrial membrane, which is the outside of the mitochondria and also the inside of it. You can see all this respiratory chain just means the 5 complexes where the cell in the mitochondrial use by passing the electron down the chain through various reactions to make energy in the form of ATP. And with various mitochondrial conditions, this chain or the supply to this chain is disturbed so that there's a problem with energy generation from this complex. You can see also in this complex that one of the byproducts is actually this thing called ROS, which is reactive oxygen species. So if you will, this could be a damaging ingredient as a byproduct of cellular respiration. And it is also why antioxidants are often used in mitochondrial disease to try to help control these and the damage to the cells. So in terms of the different vitamins, it's just to quickly to look why they are used in the scheme of controlling things. So things like vitamin B, like thiamine, nicotinamide, carnitine and things are working to help enhance the respiratory function, respiratory chain function. Whereas things like vitamin B2, the riboflavin, coenzyme Q10, idapanone or EPI 743, which is not currently available in Australia, but it's a vitamin E analog and studied in clinical trials. They basically move the electron along in the chain to help the ATP production. There are vitamins such as C and K that helps bypass certain complexes in the respiratory chain. And then there are antioxidants that works to reduce the damage from the reactive oxygen species. And creatine as such will work on energy buffering. Now, I'll just throw this slide in. Don't worry about all the different long names, but other than to say that there are a lot of factors that are involved and different supplements that work on this mitochondrial biogenesis or mitogenesis, basically working on the cell being to reproduce or in a way produce more mitochondria. So that the cell can produce more energy with more of these. And you can see that NAD or nicotinamide adenyl dinucleotide, so NAD+, which is the precursor, which nicotinamide riboside is the precursor, activates a pathway called sirtuin. And these then in turn actually activates this other pathway called PGC1 alpha. These are just names. And all these other names that are involved ultimately to signal to cell to make more mitochondria. And things like bisafibrate or resveratrol, which you might have got overseas or from supplement shops, all work on this pathway to make more mitochondria. Now, vitamin B3 is one of many vitamin Bs, but under it are many different forms of it. So NAD1, NAD plus is one, but niacin, which is nicotinic acid, often used to treat people with cholesterol problem and people with very high triglycerides, used by cardiologists and GPs, is one form of B3. Nicotinamide and nicotinamide riboside, some of you might have tried, is also a form of vitamin B3. Now we move into the evidence base of it. Now, this is the study that I might have mentioned to some of you that we were waiting. It was in the poster form, but it's now come into publication. So it's a trial on nicotinic acid or niacin in people with CPO, droopy eyelids, mitochondrial myopathy, and exercise intolerance. What they found in this study is that the higher the ratio of NAD, so higher NAD plus and lower the reduced form of NADH, and which often happens in someone who's starved or fasting, can activate a cellular response that gives health benefits. So you might know about it in people hyping about, fasting for 12 hours a day or the 5-2 diet or whatever it is to try to activate this pathway. Now, in people with mitochondrial disease or dysfunction, this NAD plus concentration is actually reduced. And they found this in these patients on the muscle biopsy and as well as in blood. So they tested niacin in a small number of patients, just 5 of them. And these patients have their CPO from different kind of deletions, either a single or multiple mitochondrial DNA deletions in the muscles. And they slowly ramped up the dose from 250 to 750 to a gram per day and continue it for 4 months, but measure their outcome over a 10-month period. Now, the majority of them, when they got to over 500 milligrams a day, had significant side effects of hot flushes, tingling in the hands and feet, and also with gastrointestinal symptoms. They're farting more and they have dry skin. And in fact, 2 control people, so they are people who don't have a mitochondrial disease, had to bail out because of the side effects. But they found that once people tolerated it, after having it for a number of weeks, they then started having benefit from the niacin when they studied the patients at 4 months or 10 months. So, and it sounds very good. People had reduced whole body fat, they have reduced fat around the abdomen or the organs and around the liver. They have a higher amount of the good cholesterol, the HDL. They have, however, increased fasting glucose, but did not affect their overall 3 months sugar control as reflected in the HbA1c. They have improvement in their muscle strength, but interestingly around the abdominal area, more than in the upper limbs, more than in the back, and the lower limbs weren't really helped by this. And they had reduced lactate production after the person had exercised. But niacin did not actually help with their eyeball movements or their maximal exercise capacity. And to look out for is that niacin actually made some of them, their red cell counts lowered. So they were monitored for these parameters during the study. In mice, we know NAD plus improved the structure of the mitochondria of the muscle itself. It also increased the COX activity and the muscle mass in mice, but it did not actually change the genetic content within the cell or the actual structure of the mitochondria, or actually the FGF21 or GDF15, which are mitochondrial biomarkers. In human, though, it downregulated the mTOR pathway. So remember, this is the garbage disposal system of the cells, okay, and activated this PPAR signaling pathway that helps make more mitochondria. And there has been study more recently about nicotinamide riboside. Why we suggested sometimes in the past of trying nicotinamide riboside is that it tends to cause less side effects, it tends to be better absorbed, and it has shown that it increases NAD levels in blood, and it's safe up to 1 gram twice a day for the short term, or for a longer term, at least in healthy patients, healthy people up to 8 weeks. Now we'll come to coenzyme Q10. Now we're familiar with this, and it's got an oxidized form called ubiquinone and a reduced form called ubiquinol. It's an electron carrier in the respiratory chain as a cofactor, and it transfers electron from the first and second complex over to the third complex. It's actually a very potent lipid-soluble antioxidant. It gets rid of that ROS, the reactive oxygen species that can be toxic to cell. It's actually made within the body, so it's actually not a vitamin. It's made de novo on its own. It's of highest levels in the heart, kidney, liver, and muscle, and its absorption is enhanced with lipids. But interestingly, the later studies actually show that the crystalline form, the bioavailability within the body is actually low and inconsistent, whereas we can see in the later study that the capsule forms in smaller doses, but with more capsules, might be better absorbed. But this coenzyme Q10 you can take to quite high doses without causing side effects or significant problem. So we know about previous randomized trials on small numbers of patients that might help with exercise aerobic capacity, and it's helpful with people with primary coenzyme Q10 deficiency. And in muscle, if you take it in the thigh muscles, they have found that in older people who tend to have more type 1 fibers, if you take it, you actually increase the type 2 fibers. So your muscle actually looks younger, okay? But we know that only works in about a fifth of people, okay? We don't exactly know why, but a lot of you might take it, but some of you might find that it's actually of no use to you. So we know that coenzyme Q10 deficiency can occur as a primary deficiency or secondary deficiency. Some of the partners of people with mitochondrial disease might be more familiar with statin myopathy, so things like Lipitor, Crestor, and those kind of things. We know that it's a thing that's made within the body, within animals, and supplements nutrition is effective in increasing the amount in the blood. Statin can reduce the amount of coenzyme Q10, which is why people who have muscle aches and pains or problems on this statins, often the GPs will ask even healthy people with cholesterol problem to take coenzyme Q10. Now, this is a study on 7 different formulations of 100 milligrams of coenzyme Q10, and they found a particular gel capsulated form of coenzyme Q10 that does not actually have vitamin C is better absorbed. So you can see the range, even the same dosage of coenzyme Q10 being absorbed very differently and distributed differently over 2 days. So that's just to say, yeah, maybe what we suggested regarding the powdered form of the coenzyme Q10 wasn't necessarily the best option. Now we've got idebenone, and because I've actually talked about this before, I might go through it because I know that time is coming up. It's a short chain quinone, so an analog of coenzyme Q10 taken up by cells more readily and can cross the blood-brain barrier. It's also an antioxidant, and it's also an electron carrier directly to complex 3. When taken with food, it increases what's absorbed into the body, but it actually goes through what's called first path metabolism through the liver very quickly. So within about an hour, it's gone from the blood and goes into its metabolites. So we know about the study about in Leber's hereditary optic neuropathy that it did not reach primary endpoint, but for people who have difference in their visual acuity, it helped at 24 weeks. There has been a more recent study on 7 people and 14 eyes to show that even people who started with a longer delay, that maybe it was helpful to them, and it was proposing whether the use of idebenone in those with even established optic atrophy could be helpful. But again, this is debatable because idebenone, through further studies, we find that it actually does not help people with primary coenzyme Q10 biosynthesis defect, unlike coenzyme Q10. And the study that was in MILAS actually still has not been published. So we wonder whether there was some, no really effect from its use in MILAS. And there's been 2 more recent studies on why they conjecture idebenone helps some people with Leber's, and does not help other people. It's because of this thing called NQ01, which is this thing with a long name. They actually think that cells need to have an adequate amount of this NQ01 before it can activate the idebenone to make it work. So idebenone, in a way, is a prodrug, and without NQ01, it doesn't work in the cell. Another study actually finds that if the person's cells are deficient in this NQ01, taking more of the idebenone could actually worsen the reactive oxygen species production and have a bad effect on the respiratory chain. and causing more problem for that person. So again, the emphasis is whilst we look to certain study, a supplement being helpful might end up potentially causing problems. So it needs further studies. So now we're finally quickly going into the MILAS specific supplements. L-arginine, for anyone who's had a stroke-like episode will know about it because they take a high amount of it. They often take 20 capsules morning and night just to get enough. We reserve it exactly because of the pill burden for people who actually have had stroke-like episodes rather than those who just have the 3243 mutation but not yet stroke-like episodes. It works on the nitric oxide pathway, and in a small study of 24 patients with 34 stroke-like episodes in Japanese patients actually, is shown to have reduced recovery time, reduced the frequency of stroke-like episodes and the severity of those. But exactly because of these small numbers, we know that people in Newcastle upon Tyne actually don't believe in its use as much, whereas people over in the US would believe in its use much more. The loading dose, if someone gets into hospital, is 0.5 gram per kilogram, whereas normal oral routine supplements in people who have had stroke-like episodes, 0.15 to 0.3 grams per kilogram. Now, the newest thing is more about L-citrulline. There has been suggestion that taking citrulline can, through this cycle of nitric oxide cycle, come to become L-arginine, because citrulline is a lot cheaper than L-arginine, where the supplementing people who can take it orally might be actually more effective than supplementing with L-arginine. But the problem with citrulline is that it's not yet available in intravenous form. And what we know is certain clinicians have already advised patients to start taking citrulline rather than L-arginine. It's been studied in small numbers in children. It seems to have increased the de novo synthesis of arginine in these patients. So finally, taurine. Now, taurine is actually in Red Bull as well. It helps with the modification of the signal RNA in patients with MILAS. 4 years ago, it was only studied in 2 patients with MILAS for over about 9 years, so the evidence base isn't strong. But recently, a Japanese study has been published in 10 people with recurrent stroke-like episodes. And the Japanese study is suggesting that perhaps it could be effective in reducing the recurrence of stroke-like episodes. But mind you, 6 out of 10 people over the 1-year period did not have recurrent stroke-like episodes. And having said that, this is a short period because people who have recurrent stroke-like episodes don't always have it within the year. So keeping all that in mind, you know, whether we take this on board, whether it's likely to be helpful or not. But I think a bigger study that goes for longer might be more helpful for us to tell whether taurine actually helps. So in summary, today we've gone through supplement use in 2020 in these domains, and I might pass the time back to Tony and Scott in case you've got questions. Thank you.